Hi, let's talk about the axilla. Axilla is the space between the upper arm and the side of the thorax. It is bounded in front and behind by two axillary folds. Anteriorly, it is bounded by the anterior axillary fold, and posteriorly, it is bounded by the posterior axillary fold. Axilla communicates above with the posterior triangle of the neck. It contains neurovascular structures and lymph nodes for the upper limb and the side wall of the thorax. Anterior axillary fold is formed by the pectoralis major muscle, and the posterior axillary fold is formed by the latissimus dorsi anterior major muscles. Axilla contains floor, anterior wall, posterior wall, medial wall, and the apex. Apex is bound by the clavicle, upper border of the scapula, outer border of the first rib, and it is the channel of communication between the axilla and the posterior triangle of the neck. The floor of the axilla is formed by the axillary fascia, which is extending from the anterior axillary fold to the posterior axillary fold, and from the fascia of the serratus anterior to the deep fascia of the arm. The suspensory ligament from lower border of the pectoralis minor is attached to the fascial floor from above. Anterior wall, it is formed by pectoralis major, pectoralis minor, subclavius, and the clavipectoral fascia. The posterior wall formed by the subscapularis, teres major, and with the tendon of latissimus dorsi. The medial wall is formed by the upper part of the serratus anterior, and the lower limit of the axilla being defined as the level of the fourth rib.